Hello, everybody. Welcome to Pod TV's Medicine and Science show. My name is Nick Pellavita. I'll be a moderator, but not the host of the show. And today we have a very exciting topic for everybody listening if you haven't followed the health area in the United States of America. It's a person called RFK, RFK Robert Kennedy Jr., who's an attorney, an environmental attorney, became head of Health and Human Resources. He took over. So now he's not really a doctor, but he kind of plays one at the Trump White House. So we're going to find out, is he brilliant, as he says he is, and Trump says he is, or is he bogus, which is maybe the case. But with that, we're going to bring in a real medical doctor to do the analysis. He's Dr. Michael Patmos, who's actually board certified in internal medicine, to give us a lowdown on what we can expect from this administration and our favorite topic of today, RFK. Is he brilliant or is he just bogus? What is it?
Well, good morning, Nick, and good morning to the viewers. Thank you for the privilege of spending a little time with you today. I'd like to talk some more about RFK and what he's doing, and then some of his downstream appointments and what they're doing. There's some news that broke yesterday about a new appointment at the FDA for the director of the Center for Biologics Evaluation and Research. And that's a very controversial and I think terrible choice. And I'll tell you more about that in a minute. But first of all, just to remind everybody, I am a board certified internal medicine physician with 44 years of clinical practice. I also have added qualifications in infection control and hospital epidemiology. I've served on the faculty at 3 medical schools and for a time was a director of infection control and hospital epidemiology at a large medical center. Robert Kennedy is a lawyer. He has no training in science. He has no training in medicine, internal medicine, infectious diseases, vaccinology. He has no qualifications to clinically or scientifically. He has no qualifications. So for him to be in charge of Health and Human Services, he's qualified from the point of view of law. He understands law, but and there's certainly a legal basis for how that department operates in the federal government, but he's not a clinician. He's not a scientist. He has no right, morally, ethically, or legally, to give medical advice. And that's exactly what he does. Mr. Kennedy is a very well-known anti-vax enthusiast. He has been for decades. He strongly supports and helped popularize the idea that vaccines cause autism, which they don't. And he's now, in charge of, he's the highest ranking health official in the United States. I could talk for days, and lots been written and said about Robert Kennedy, but I would just boil it down to one simple concept. He, in his book, states clearly that he does not believe in germ theory. And just stop and think about that. Here you have a person who's in charge of Health and Human Services who doesn't believe in germs. So the germs cause disease. So, it tells you everything you need to know about RFK. What I want to focus on today, and by the way, he's giving all sorts of he's advising the country on how to manage measles with alternative therapies like vitamins and so forth, for which there's no basis. Why is a non-physician allowed to advise the public on how to treat and prevent diseases? That doesn't seem legal to me. In any case, that's what he does. But what I want to talk about today is not just Robert Kennedy, but who has been appointed to very important roles in the government because of him, who he has his choices on his team. He basically appointed Dr. Marty Makary, who's a surgeon, a fine surgeon from Johns Hopkins, transplant surgeon, I believe, or pancreatic surgeon, to head the FDA. Dr. Makary is a vocal, outspoken critic of vaccines and COVID vaccines, and he's been a celebrity on Fox News, but he's a surgeon. He is not an infectious disease doctor. He doesn't have any training in the area of microbiology, infectious diseases, vaccinology, virology, et cetera. He is a surgeon. I'm sure he's a fine surgeon, but he doesn't have the correct credentials to opine as an expert in infectious diseases. That's preposterous. That'd be like taking an infectious disease doctor and putting them in the OR and having them do pancreatic surgery. You have to stay in your specialty. Dr. Makary is outside of his specialty. He is an expert in surgery. He's not an expert in infectious diseases. Certainly not an expert in the regulatory oversight of vaccines and medications and so forth, which is what the FDA director or commissioner does. Dr. Makary just appointed a very controversial person to the role of the director of the Center for Biologics Evaluation and Research. That is the portion of the FDA that has oversight of vaccines, biological therapies, and gene therapy and the research around it. So you would think that the person who was appointed to that role would have expertise in vaccines and biologics and gene therapy. No, who did they pick? They put Dr. Vinay Prasad in that role. Now, who's Dr. Prasad? Dr. Prasad is a very highly educated, brilliant physician. He did an internal medicine residency and a hematology oncology fellowship. He has a master's degree in public health, and he's a faculty member at UCSF. And he's a very good clinician and a very good teacher. He's won many teaching awards. He has gained a lot of notoriety for his concept of ending medical reversal. What that is where something we think is good later turns out to not be good. Well, that's just the nature of science. We are always constantly evolving and changing our opinions on things as new evidence comes in. But he got himself quite famous with this topic of medical reversal. But here's where I have a problem with Dr. Prasad. Dr. Prasad has basically echoed everything Robert Kennedy says. Whatever Robert Kennedy says, Prasad seems to echo. He's anti-vax. He's anti-COVID vax. He says children should not be vaccinated against COVID. I guess he doesn't realize that 1,800 American children died of COVID. Thousands more have been affected by it negatively with long COVID. I do prior authorization reviews in California where Dr. Prasad practices. I personally authorized 2 lung transplants on children who had COVID, whose lungs were destroyed by COVID. So when he says that kids are not at risk from COVID and don't need to be vaccinated, I don't know what world he's in, but he's certainly not taking care of children, that's for sure. And the other thing about Dr. Prasad is not only a sort of a sycophant for Robert Kennedy and, supports Robert Kennedy's ridiculous stand on things like raw milk and so on and so forth, but he also has a Substack called Sensible Medicine that he started. It now has, and he has a YouTube channel with 200,000 viewers. He's generating a lot of income in addition to his salary at UCSF. So he's really an entrepreneur in social media, and he's taken a very contrarian, anti-scientific point of view, which he portrays as being scientific, but he really attacks scientists. And he doesn't just attack with data or, in a diplomatic way where doctors debate back and forth. He uses very vile and vulgar terms when he talks about other people. Let me give you an example. The person he replaced at FDA, Dr. Stephen Marks, is really a giant of medicine, very, very respected man around the world, professor at Harvard, chairman of hematology oncology, I believe, at Beth Israel Deaconess, really a giant of medicine. He's been at the FDA for many years. Well, Dr. Prasad referred to him as a mediocre academic and said he was the worst person in this job ever, that he was basically a shill for big pharma. Those are defamatory comments and very unnecessary and unhelpful. Kennedy's within his right to replace him if he chooses, but to then go out and attack this man's reputation the way he did when Dr. Prasad doesn't have his level of qualifications. Dr. Prasad is an oncologist and a professor. He doesn't have, Marx has risen up the ranks and been a chief at Harvard. So there's to say that he was, a mediocre academic is really just beneath the dignity that I would expect of one professional to another. But let me give you an example of the kind of thing that Dr. Prasad writes that is really offensive, and that just to me makes him unqualified for such a prominent role. He wrote in his Sensible Medicine podcast, Sensible Medicine Substack, an article, and I'm sorry for the vulgarity, but this is the title of his article. His article is entitled, this is in Sensible Medicine. You can find it online. The article is entitled Blood, Shit, Piss, and Pus: What We Touch in the Hospital and Who We Are. And the point of his article is basically there are two kinds of people in healthcare. People who come in contact with blood and body fluids and so forth, and those who don't. And he disparages those who don't. And he in earlier versions of this Substack, he referred to administrators, hospital administrators, as, quote, abject pieces of shit, end quote. I pointed that out, and now he has since gone back and taken that out of the Substack. But I have a problem with using that kind of language for as a physician writing articles. It's just inflammatory and degrading and very unprofessional. And how you can end up being in such a high-ranking position when you refer to other people in healthcare in such vile terms. I suppose Dr. Prasad doesn't realize that many of his colleagues are healthcare administrators. Medical directors are healthcare administrators, chief medical officers, department chairmen, section chiefs, deans, chief medical officers at the hospital. All of these physicians are also executives, and they're also administrators. So when he across the board refers to administrators as abject pieces of shit, he's referring to his own colleagues and his own boss, as a matter of fact. I think that's really offensive. The article that he wrote with that horrible title goes on to describe what he says he encounters and touches blood and body fluids and excrement on a frequent, if not daily basis, and that everybody in healthcare in the clinical trenches comes in contact with this stuff every day, and we're at risk because of it. But those administrators who tell us what to do never have to touch blood, shit, piss, and pus. Well, I'm sorry, but he's mistaken. Yes, there are risks of exposure to blood and body fluids in the hospital environment and office environments. That's why there's a discipline called infection control or infection prevention. Hospitals have entire departments devoted to preventing these kinds of exposures. No one in healthcare should have an exposure to blood or body fluids. That is a high-risk situation for transmittal of disease from patient to provider, and then infecting the provider or the healthcare worker, in turn infecting others. We have all sorts of policies, procedures, infection control practices, isolation, personal protective equipment, gowns, gloves, masks, all sorts of things that we do in healthcare to prevent exposure to blood, body fluids, and excrement, and so forth. So when he says that he just comes in he just steps in this stuff every day and he touches it every day and it's no big deal, and all doctors and nurses do, and it's just these administrators who have no clue, that's just so offensive. And to write an article with that kind of a title referring to these biological fluids in this way is so beneath the dignity of a physician. That's who's now in charge of the FDA's Department of Vaccines, Biologicals, and Gene Therapy. Dr. Prasad is very highly qualified. He's an oncologist. He's not an infectious disease doctor. He's not an infection control doctor. He doesn't have any specific training in vaccines, gene therapy, and he prescribes biologicals, but he's not a researcher who develops biologicals. Now he has oversight of the development and the research of all of these areas, and a rabid anti-vaxxer. He has, for example, called for annual placebo-controlled randomized trials of all COVID vaccines every year. Well, to do that would mean no one would be the end of vaccines, which is really the agenda for RFK and his team. These people want to bring about the end of vaccination, the end of immunization. The public health intervention that has done more for humanity than anything else we've ever done is vaccination, immunization. And these people are hell-bent on destroying and ending vaccination in this country. We are in grave peril. We have a cabal of people who are anti-scientific, who are now running things, and they're telling everybody else what to do. They're dictating our policies, and the public health will suffer as a result. This will eventually fail because what they're advocating for is patently absurd. It'll eventually will fail, and we'll come to our senses, but it's going to take years. And in the meantime, we're going to continue to see measles, polio, and all the other things that we should be preventing are going to start occurring in greater. And I've told you, I already predicted that measles was going to explode, and that's exactly what is happening. This is going to continue until someday we wake up and realize that we've put the wrong people in charge. And Dr. Prasad, in my opinion, is unfit for this role for many reasons, not just because of the way he believes, but very importantly because of the way he speaks about his colleagues and his peers. He says administrators are abject pieces of shit. Well, he's now an administrator. Welcome to the toilet bowl, Dr. Prasad. Anyhow, that's my comments for today. Let's discuss it.
Well, that was very interesting. But for people who don't understand what this really means, it's like if you understand football, it's like taking your offensive lineman and put him as a wide receiver.
Right.
It's not a good idea. Now they could be the best offensive lineman in the world, but they just don't fit as a wide receiver. And that's what I'm seeing this administration doing. Like I said, if it was a football team, the critics would be all over these people because you're taking an offensive lineman who could be a good offensive lineman, and you're making him a wide receiver. You're taking an attorney like RFK who could be a good attorney, and you're making him a head of science, which he knows nothing about. Because I can tell you, I went to law school. I went to law school for 4 years, got 2 law degrees. And you know how many medical courses I took? 0. You know why? Because that's how much they offer. You can't take one. Yeah, Rick.
So the craziest thing you said was that RFK doesn't believe in the germ theory of disease. So I looked it up. Anton von Leeuwenhoek, one of the first guys to use a microscope, first observed microscopic organisms 350 years ago. Now, people have been speculating that microscopic organisms cause disease for more than 2,000 years. And then they've been accumulating visual evidence of it for the same amount of time since Newton first described general gravity. Not believing in germs is like not believing in gravity. It's one of the most well-substantiated theories in science.
It's right in RFK's book.
It's
176, I think, or 156. It's right in his book. He doesn't believe in germ theory.
And I got to throw in RFK's personal life. RFK was addicted to heroin for 14 years, from age 15 to age 29. If you look at his whole history, it's a few good things and a whole lot of flaky bad things.
A quick question for you, Dr. Patmos, and it's along those same lines. Unfortunately, there's a lot of misinformation, even in your favorite place, which I'm sure RFK Jr. is not helping with, which is social media, because I was actually on social media earlier today. I think it was on Facebook, or it might have been Instagram, and somebody was saying and asking the question whether they had noticed that people that took the shot were having their personalities change. So now the latest thing is that if you took the shot, your personality has changed, and that is what this person was spouting in their social media. So what is your answer to these folks that are saying, hey, you took the shot and now your personality has changed?
So this gets at a common thing that the anti-vaxxers do. They cite association, particularly VAERS. VAERS is this website that the CDC has where anybody can report anything if they think there was an association. And it's just a sort of just a repository for observations. 90% of them, 99% of them turn out to be unverifiable, inconsequential, coincidental, unsupported, whatever. But some of them are very entertaining. there are actually people who have submitted VAERS reports as adverse vaccine events, complaining of becoming demonized and becoming turning into monsters and so forth. I mean, people claim all kinds of things. Pregnancy. Some people claim they got the COVID vaccine and they became pregnant from the vaccine. Others have developed piloerection. What's that? That's where your hair stands on end. Anyhow, there's all sorts of, if you look up crazy things that people have reported to VAERS, it's a laundry list of hysterical stuff. But anti-vaxxers take those reports as if they're actually factual, and then they spout them. Like, so this person said they had a personality change because they had a COVID or because they had a vaccine. Well,
so let's talk about what VAERS is and why it's important. VAERS is when you go to the doctor and you've got broken arm, you've got diarrhea, whatever you've got. The doctor is supposed to ask, any vaccines lately? And then the doctor files a report saying, somebody came in, they had this, they got vaccinated this long ago. And with things like the swine flu, for instance, the swine flu, like one person in 1,000, I think, who got that vaccination, maybe fewer, they got Guillain-Barré syndrome, which is a form of paralysis that's not good. So that system was able to show statistically that people were getting Guillain-Barré at a higher rate after getting vaccinated. So that's why you need a system. But the VAERS idiots, the people who misuse the system, take all these reports and they don't do any statistical analysis. They just say that so-and-so who got vaccinated 3 weeks ago started having boners all the time. And they don't look at the rate of people having persistent boners, like from whatever. And they say, well, so the vaccine causes boners.
I just had a conversation with a doctor the other day on LinkedIn who was arguing. He said, I've seen so many patients whose children stopped speaking after they got the vaccine, after they got vaccinated. So that's association, taking association to events occurring in time and attributing causation to it. There's an old Latin phrase, post hoc ergo propter hoc, meaning, in other words, because event B follows event A, therefore event A caused event B. That's not true. So I'll give you an example. So for every single, here's an observation I made. Every single person who experienced a side effect after getting a COVID vaccine had breakfast within a few days before the symptoms occurred. Obviously, having breakfast is the cause.
Breakfast is the cause and everything like that. Amazing.
Another observation I made is, all these people who died from the COVID vaccine, most of them were wearing underwear. That must be the cause. You see, the problem is that there's an infinite number of things that you can associate event A with event B with. You have event A, B is an infinite number of possibilities. So you cannot take an association and attribute causation. That's sixth grade science. And that's what all these anti-vaxxers do.
And you need to be able to know statistics and do statistical analysis to see if there's a difference between the unvaxxed population and the vaxxed population in things happening to them. I bet you RFK Jr. has never taken even a freshman level class in stats.
I doubt he did that. I did have a question for Dr. Pat Messer on a different subject, but it is a popular medical thing, and you've actually brought it up a couple of times, Rick, and everything. But Ozempic is a drug that a lot of people are using for various reasons, including primarily weight loss. But they are now saying that it can help people recover from substance abuse. So I was just wondering your take on this notion of one drug being used for something else when it was designed.
Yeah, I use not minoxidil, dutasteride, for two reasons. But I started using it for a reason it wasn't prescribed for, to keep my hair from falling out, because the same form of testosterone that makes your prostate blow up and make you have to pee every hour, overnight, it's the same drug that makes your hair. The same form of testosterone makes your hair fall out.
Oh my God! Now you tell me.
Yeah, so we could have saved you But so people use, there are lots of off-book uses for drugs.
So-
Minoxidil started off as a blood pressure drug. Then people would go into the doctor 3 months later, said, "Doctor, I'm growing hair every place, including back on my head." Now minoxidil, you put drops on your head to grow your hair. It was.
So just a word about, you asked about Ozempic and these GLP drugs. This is a very important group of drugs. They were developed and used for many years now for diabetes. And in the course of being used for diabetes, it has been observed and associated that patients lose weight. And in randomized trials, these drugs clearly are very effective at helping weight loss, which in turn leads to a lot of other benefits. So this is an important group of drugs. They have side effects and they have to be used properly and with proper supervision. But for the right patient at the right dose, they can be very safe and very effective for weight loss. And I think they're a big step forward. Problem, they're very expensive because they're all patented, but there are some compounding pharmacies that are offering a workaround now.
Hey, Dr. Patmos, I know we're winding down and everything, but what are your thoughts? Because I saw, and it came out of California, that there is a one-time release capsule that could replace taking multiple pills. So if you know some folks, and I have some folks in my family that are taking multiple pills, they will just have a capsule that will have, I guess, all the pill components in the one drug and everything along those lines. I don't know if you swallow it or how it'll work, but they're talking about this one-time release capsule that can replace multiple pills, which would save a lot of people's space in their medicine.
Well, I don't know about that particular example, but I can tell you, for as long, I've been a doctor nearly half a century, and there's always been an effort to combine medications together to reduce the number of pills that people have to take. The classic example is the blood pressure pill, like a beta blocker combined with a diuretic. And many of you know about a beta blocker called Inderal or propranolol. Well, you can get propranolol along with hydrochlorothiazide together in one pill. So instead of taking two, you're taking one. So there certainly are, and there are other combinations of antihypertensives in particular, where 2, 3, or sometimes even 4 medications are in one pill. Some of the antiviral agents are multiple medications in one pill, because it's hard for people to comply when they have to take lots of different pills every day. They have to have entire systems to remember what they take when. And so if you can combine things, it really is helpful. So I don't know about that particular instance.
I take that combination. I didn't know that. I could combine the two. I keep track of my pills by moving the bottles from one side of the counter to the other. If somebody pushes them all to the side to sponge something, I'm screwed.
So now you can take
Ozempic, here's another side effect of Ozempic today. Weight Watchers declared bankruptcy.
Yes.
Because with Ozempic, you don't need willpower, which is great, because when you look at the rates of people whose dieting fails, it's like well over 90%.
So I guess that means Jane Fonda is going to go bankrupt next and everything along those lines, and she made a lot of money off of weight loss, as did a number of other folks. I did see that there was CDC was in the news a couple of days ago as well, Dr. Patmos, because apparently the animal sedatives, metadone, or I'm probably mispronouncing it, but it's showing up in the U.S. illegal drug supply, but it's one that's used to sedate animals. I'm thinking like horses and big animals like that, but apparently I guess the folks want to use it as a form of the illegal drug market and everything like that. So
what drug is this? What was
it's spelled MEDETOMIDINE.
Yeah, I can't comment off the top of my head. I have to do some research. I don't want to venture into areas I'm not prepared to address.
You're obviously not Donald Trump, then. No, he's expert in everything. But it was nice that he actually did defer on due process. I thought that was one of the smartest moves he made recently, because I'm not an attorney. I don't do due process. I wish RFK would say, I'm not a medical doctor. I'm going to defer these medical issues to a real medical doctor. That'd be a very strong statement for him to say it. I wish he would say it, because as an attorney, I hate seeing attorneys parade around as if they're experts in the medical field, and they are not. And with that, we're at the half hour. So I want to thank our expert, Dr. Michael Patmos, our viewers in the United States, our viewers around the world. Just remember, if you're looking for good medical care, you may in the future look outside the United States of America, and definitely not the government.
Are they going to look in Spain, Nick? Because apparently
Spain's cool, but I'm telling you, if you're anti-government, now's the time to be anti-government.
Yeah, look around, like knee replacement, 70% less expensive if you go overseas.
Well,
Hair,
there's a man that
hair
is suing Ozempic, by the way,
transplants, if you
because
go to
there's a loss
Istanbul,
of vision.
Turkey.
Speaking of causality, so apparently he's saying that he took Ozempic and then he went blind. So it kind of comes back to what Dr. Pappas was saying. So I don't know that that causality is actually going to work, but that's what he's claiming. He's saying that Ozempic made him blind.
You need to compare the number of people who went blind after taking Ozempic to the rest of the population to see if there's a higher rate of blindness. You need to do statistics.
Yeah, well,
People lose
that's
vision every day.
basic science. I think they failed those basic courses. I was looking at Van Woliko and who did germ theory, but frankly, I didn't look at that since high school because through my MBA classes, JD, LM, they didn't teach you any of that stuff. So I want to know one thing: your friend RFK knows nothing. And with that, we'll sign off, and we'll see you next week on Medicine and Science. So the TV Network. Bye bye.